can you isolate the marmas from your body? Can you? No. Do you believe that marmas are there in your body? If anybody is there who believe that there are no marmas in the body, to emphasize that, I will always tell that, what you call, the first sloka in Dosha Vijnaniyam, Dosha Dhatu Mala Moolam Hi Shariram, Dosha Dhatu Mala Marma Moolam Hi Shariram, I will, if permitted, I will. And do you know that the Marma Shastra is the only contribution which is of that much stature to the whole understanding of human anatomy and physiology? For those who are there, anybody who was there in Yantra conference in Bangalore? Those slides may be repeating. My classes will be the same only. Shastra, you cannot tell that, okay, Ashtanga Hridayakara, Bhagbada or Sushruta has written Marma Vibhagan Shariram, Ashtanga Hridayakara has written Marma Vibhagan Shariram, and every day it has to be changed. It will not happen. So my slides are also, so those who are there, most of them will be repetition only. But I tell you that you see your latest edition of Gray's Anatomy, Guidance Physiology, and there will be only one chapter missing from what has been told in Charakam Shariram, Sushrutam Shariram, and Ashtangradayam Shariram, or any Shariram, Ayurveda Granthas. Which is that chapter? You can see the latest, most details about any of the blood vessel, any of the muscle fibers, muscle tendons, ligaments, nerves, nerve sheets, bundles, any cells. You can see very detailed explanation, which is very, very, very rudimentary, very suggestive only in Ayurveda Sharira. You will get all those things, except the concept of Marma and the knowledge of Marma. So, are you richer than your modern counterparts as far as Sharira Rachana is considered or not? Have you ever felt that you have a richer knowledge about the functioning of the body than the modern anatomist or modern physiologist? Have anybody felt that? Have you felt that? Those who have felt that, show, put up here this one. See that this is the change what I told. Now after some time, after going into that, okay, understanding that, okay, now first point is that it's the biggest, the easiest claim you can make, because I know that how the people, 5% of the people come for, okay, Ayurveda, I am for Ayurveda, like we have him like son of Dr. Suresh, dedicated to Ayurveda. For even if I get modern medicine, I will not go. Like that. The other 90% will be coming by, I also came by chance only. I don't belong to any traditional family or anything like that. Nobody in my, this one is a modern doctor also. Nothing. I am a farmer's son. Okay. So, I tell you that now at this point you will be always feeling very, very, very dull, like I don't know much, like that MBBS, my colleague who went to medical college, I did not do. They did, 10 people only did the dissection. We all together did the dissection. These are the things which will be always pulling you down. You just ask your counterpart, okay, regarding liver I will tell you, regarding kidney I will tell you, regarding heart I will tell you, regarding the brain I will tell you, regarding the spinal cord I will tell you. Just tell me something about Marma. Will he be or she will be able to answer? Will you be able to answer? You will at least tell that, in our this one it is there. And I don't know fully about it, but there is something called, we count 107 Marmas, they are divided into this one, anatomically they are divided like this, functionally, by effect they are divided like this, etc., etc. You will be knowing. So who is better? Who is better? If you feel that whatever you have been in the syllabus you have not learnt well, that is not the syllabus fault or teacher's fault. This is your fault only. So you should be there able to tell that I know whatever you are knowing, maybe not in that much detail, but you don't know something which I know. அப்படி இருந்த ஒரு ப்ரைடு வருமே, அது இருக்குதா அப்போ? ஃபர்ஸ்ட் that's what I want to tell you. Do you feel proud that okay, I know something better than the other medical system person do not know? கை போக்குங்க, அப்படி தோணுவாங்க. If you don't feel, don't put up. You are shy, I am always what ayurveda. அப்படி இருந்து there is no, you have to first of all, இல்லைவா புகழேந்தி இங்கே ஃபர்ஸ்ட் ஆஃப் ஆல் pat your backனா நாங்கள் சொல்லுவோம் pat your back here, மூலாதாரத்தை தட்டுங்க, மூலாதாரத்தில் உட்காருங்க. You be seated. You understand that the knowledge fountainhead is it should be there. It is there, and that only can இந்த பார்த்துருக்கீங்களா தீபாவளிக்கெல்லாம் வெடிக்கிற பூக்குத்தி, அதுதான் எக்ஸாம்பிள். அதோடு நீங்கள் ஒரு ஜுவாலை கொடுக்கணும், அவ்வளோதான். எங்கேருந்து வருது? மேலேருந்து கீழே வருதா? Anybody who knows Malayalam only? Who does not know Tamil? A few of you. From Maharashtra, Karnataka? Maharashtra. कोई बात नहीं, कुछ संदेह तो कुछ संशय है तो उसके बाद गरिमा डॉक्टर है गुजरात से, थोड़ा हिंदी वाला भी है. So you will be knowing, because I believe that it is much easier when we learn something in our own mother tongue, whether it is our local tongue, lingua franca, than exploiting too much regarding this one. One wrong thing we teachers do, that's what I told, include Pugalandi, I don't know, but I'll take him as an example because he was my boy. So so I tell this because in many of these things I am supposed to be not that much professional scholar, because I tell that teachers, I also tell you that please educate these students in the way, simplest way, in the way they can understand and do it. Please don't go in for, I have great respect for Sanskrit. I have great regard for the Pandits of the Sanskrit, etc. But as an Ayurvedic scholar who is going to have a breadwinning situation from what he is learning, please make it very simple. Break down the samhitas into the easiest way you can serve. Don't always serve biryani. என்ன ஆகுது தெரியுமா ஆயுர்வேத காலேஜ்லலாம்? I am not a critical this one, but I am an analyst in that. You are every day fed biryani, covered in Sanskrit, and over that ice cream also every day. I tell that வாரத்தில் ஒருனா அது போடுங்க, டெய்லி கொஞ்சம் கஞ்சி ஊற்றுங்க, சாப்பாடு போடுங்க, ரசம். Make it simple. The whole of Marma chapter, if I take it and then define it along with the lines of, there is no sloka in my this one at all. Are you happy? No. Slokas you should learn. Slokas are the base. But I always tell that, you know the Shankaracharya Kriti Bhajagovindam? இது வேற ஒரு விஷயம். ஆயுர்வேதம் கற்றுக்கிறதுன்னா ஆயுர்வேதா only I will learn. No. Ekam Shastram Adhyayano na Vidyat Shastram Nishyam, you will quote and then go to modern medicine only. Not any of the Indian sciences. So Shankaracharya is one of the biggest, one of the famous Kriti is Bhajagovindam. He tells that ultimately, after realizing all, deliberating all Bhashyas or Upanishads, everything, he tells that Bhajagovindam, 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 Modamade Samprapte Sannihide Kale Nahi Nahi Rakshati Dugrunji Karane. Now, if you, I am not against, I am a Samhita teachers, anybody is there? Samhita teachers, I don't blame them. They have to sit with the Samhita and explain. I am just requesting them that they put it in the way it is needed. Every lat, lung, everything, vibhakti, everything has importance. But the bhakti is more important than the vibhakti. As it was told to Pundanam, Sri Krishna, Pundanam wrote a poem, small philosophical poem in Malayalam, and then Bhattacharya had written already Narayaniyam. So he was very feeling bad. Then God made him realize that your bhakti is as important or more than the vibhakti of so and so. So let us be Shastrik, but not a dogmatic this one and that. I think it was a very, very big introduction which I gave, because without that base, if I go, just tell and go, it will be like you go to the cinema hall, see Rajnikant or Vijay, and then or some other hero like in your Maharashtra, whoever is the hero, Shah Rukh Khan or somebody, and then go off. It is entertainment for 3 hours. That's all. Or 2.5 hours. But this is something which should make you think. And I believe that whatever you learn today, and Modi ka guarantee like, I tell you is that it's a guarantee that if you become unconscious or you become dead, then you will be forgetting. Whenever my students, I ask that, sir, hello, sir, whenever I ask them and they tell that, sir, marannu poyi, sir, nee padichittilla. Marakka ennulla, when you study, it is studying only. You don't study anything to forget it. If you don't study it, you forgot. You did not notice, you did not record it. That's all. So, do you want so much biryani or a little kanji only? Daily biryani means yesterday, today, tomorrow. There are so many biryanis means you will get ajirna only. So let us have a little rasam jadam or something like that. Something. Okay. Okay. Anyway, this was slides. Thanks to my son. He only prepared the pictures on the slide and all. Only thing is to convince that it is very easy to talk about any subject. Even if you don't do it, you can make good theoretical presentations, etc., etc. And this one. But whatever you do, it comes from your heart only. So you can see that this is our hospital only. It's a training session which was going on and all. That is the place where we learn. My old house has been converted to an academy, and so where we learn these things. Okay. So application of Ayurveda, Marma Vijnana in clinical practice and overview. So from here, I think you got the mood. How to learn is learn little, learn it well, record it properly, and promise yourself that I will not forget it until I die. Why this sir is telling about why we are all living, why he is telling about the death and other things now, will be your thought, is it not? Every one of the Marma physicians who have gone into it, whether Varmakalai or Marma Vijnanam or this one, they will all be a little philosophical, do you know? Sharirasthana, when you see, you start with Garbha Vijnana, is it not? End with what? You come to Anga Vibhaga. Without learning Anga Vibhaga, don't learn Marma Vijnana. You first learn Anga Vibhaga and then go for Marma Vibhaga. After this, what is told? Marma Vibhaga is told. After that, what is told in Ashtanga Hridaya? Indriya Vijnana. Whatever is the omens and signs of death, that has been told. After that, Dudadi Vijnani. A man's, humans, any animal's life cycle starts with its origin as a zygote and ends up with death. So Marma Vijnani is always talking about what is a Marma? Marma, that which kills, or if something is happening over there, that will end up either in pain, disability, or what you call severe incapacitation, or late, slow death, or immediate death. So we start talking about death when we start talking about this one. This is what separates between. I nowadays tell that the most foolish thing that has been done by aping the modern medicine is to separate the Sharira into Sharira Kriya Vijnana and Sharira Rachana. For us, an Ayurvedic person, a living person, living body, Chetanavat Sharira is, you cannot cut it into two functional parts and this one. Function is based on the structure, structure determines the function, provided the Chetana is there. My dear students, Marma you cannot learn from a dead body. In a dead body, whether a marma is there, you can very 150%, 250% tell that there is no marma. Only in a living body there is marma. Because prana should be there and prana nasha is marma. That is why in a marmahata, the death can occur. Now death means immediately we tell about, think about somebody has got the poach and lying dead corpse only you think. When one of the cells in your body is not getting its required chetana, then it is dying. Starts with cell, then a tissue, then the tissue made organ, then that organ made system. So that is why we have multi-system failure, multi-organ failure, multi-tissue failure, multi-cell failure, cell death starts. So we have to, every day when you define, there is a marma has to be understood in such a way. What is kaya, what is sharira? These definitions are very important. Whenever I tell that don't learn, give too much of importance to this one, I am not neglecting all those things. That which is growing, that which is dying. They gave both the names to this body because it is happening continuously. And you are healthy when you can balance the death with the life, or the life with the death. Pugalendi, 1 minute before what Pugalendi was not the Pugalendi 1 minute after. So there have been so many deaths happening, cells dying over there, so many cells born over there. You tell that RBC has a life cycle of 120 days, after that it is a new blood, new this one which is flowing over there. It's all these things we tell. Okay. And going too lengthy, I think. What is the time now? 11:10. 11. Okay. Then we will. Okay. Now, மர்மமா இருக்குது இல்லை சந்திரபாபு பாட்டு தான் எனக்கு இந்த வந்தாலே என்னமோ நடக்குது உலகத்திலே மர்மமாக இருக்குது. What does that then? Another way you learn the Shastra is that first of all don't go in for all these Sanskritic definitions over there. What is the meaning in your language? Malayalis, how many of you are there? മലയാളത്തിൽ മർമ്മം എന്ന് പറഞ്ഞാൽ എന്തെങ്കിലും ഉണ്ടോ, അർത്ഥമുണ്ടോ? തമിഴ്, മറാഠി, മർമ്മ, മർമ്മ. You don't see detective movies, detective films and other things. My friend Dr. Vinod Krishna always tells that if you want to learn marma, go and see stunt film. Go and see detective films, read detective novels, and then you will be, because already the Nidana person, the Chikitsa, Hetu, you have to Rogamado Paricheda, Tadanandaram Aushadam. You have to be a detective to see that what are gone wrong, then what the Samprapti has happened, and then to break the Samprapti. A Marma Vijnani has to be more detective. Have you seen this one? CBI films? Okay. Great Iyer, who is a CBI in this one. So remember all those things. We don't learn Ayurveda isolated from your total life. First, my dear students, it is a part of your life. This 5.5 years you are learning is a part of, make it a part of your life. Because we keep it outside and we remain separate, we cannot assimilate it. So when you want to assimilate it, you have to know that you are only learning part of it. Life is a part of your life, death is a part of your life, getting injured is a part of your life, getting hospitalized is a part of life, getting repaired is a part of your life, getting cured is a part of your life, getting healed is a part of your life. Is it not? Is it not? Peak time everybody have enough bottles of water with you? Summer, you hydrate yourself. Paniyam praninam pranaha. அப்போ சார் பிராணானா நீங்கள் சொன்னீங்க இது பிராணி, இப்போ ஜலந்தான் பிராணம் சொல்கிறீங்க, அக்னி தான் பிராணம் சொல்கிறீங்க. ஆர் யூ கெட்டிங் கன்ஃபியூஸ்ட்? Whenever we talk about prana, the first, the Ayurveda student gets only the Panchavadas are there, the Pranavada is there, Pranavatra Mordagaha. ஓ மர்மம் எல்லாம் தலையில் வந்துருச்சு. This is the way you think. I can spend 2 hours for you, not teaching anything, Marma. But I can make you see that how you acquire the knowledge of Marma. Do you want to fish or know the art of fishing? That's the thing. That is the thing. Anytime you can learn the technique, anytime you can. Okay. So Marma is always telling about a hidden Marma, that is the core point. Either it tells about the core point or that is hidden, mysterious, mystical. There is something which is behind that which I don't know. Okay, if somebody is a good astika, okay, he goes and stands in front of the idol or picture or temple. He stands there and then he comes back. Now, if you ask him what you got, I got my energy for the day, he can tell them. How do you get it? I don't know. It's mysterious. For him, it is a mysterious thing. There are so many the life is full of mysteries. Whole life is of mysteries only. So you can see that the mysterious thing which is hidden, which is, I give the example, is not Aditya. How many of you solve crossword puzzles? Crossword puzzles? Or only that ball game in this one? How many of you solve crossword puzzles? Okay. There are simple clues as well as hard clues or cryptic clues. They are called cryptic clues, is it not? Cryptic is what? Cryptic is not straight. How many of you have learned this Shastra with the love and fun of it? Anything is very easy when you love it. All the difficulties will rise off. That is why even the prana stays where there is sneha. When there is no sneha, there is no prana. Sneha keeps the bandha, it keeps it, the integrity of the thing. When sneha is there, rucha sets in, you get disintegration. Think of the disintegration that your indriyas are somewhere, your manas is somewhere, your atma is somewhere, your deha sharira is somewhere, it is disintegrated. Actually, God given, we all have that integrated system within this. But what we do, due to our own wrong understanding, wrong thinking, we disintegrate it. Even though it is there, it is not found there. My only thing is that find yourself, your core. Find yourself, your this one. What happened? I think one of you can come there so that. Before that, little more. Okay, next. Okay. Is it okay? Visible, audible? You are ready? I am ready. Proper knowledge of the location, dimension, predominant structure, number, bhavadic combination and effects of injury are absolutely needed to avoid marmakshada and also to find remedy for the consequences of injuries to them. So here also marma parivalana, protection of your marma. You see any martial art, first you are asked to protect yourself. Why you have to, if somebody is coming and hitting you on your chest, you are asked to put like this, so that even if your shaka and asti bhagna occurs, you can treat it, but not when you get it on your sadhya pranahara marma. Okay, so you have to understand that. And remedy also, you have to know that what is that? Location, dimension, predominant structure, number, and bhaudik combination. Is there something like that? Acharya has told some marmas are agneya in nature, some marmas are agni soma, vayu soma, vayu. Okay, there is the physiology that describes why some marma abhigadas end up as sadyo pranahara, kalandara pranahara, vishalyagna, vaikalyagara, rujagara is explained with the predominance of the bhautik constitution over there. Now my question, I am not going to discuss other questions now. Amsa marma is located inside the Amsa Sandhi. True or false? Amsa marma is located in the Amsa Sandhi. True or false? Please involve, then only I will be able to go fast. True or false? False. You are true. Because it is not there, it is here. How can you locate it? Many people would have taught you. Just flex your this one, put your hand over here, put your fingers over here, take it, and that will be the point. You go it further, you have the Amsafalaga marma. Amsa marma, Amsafalaga marma. Okay, so anything is measurable. After measurement only they have written, and this Shastra, I think for Coimbatore Ayurveda College students, I think Pugalandi or Poyyamari or somebody has to take. I will just request the authorities because that is needed. There are books and books, enough literature in Tamil Varma, where there is a book on Alava Sutra. How much distance this one is from another. Now we also learned isolated only, no? How Sthana Rohita is 2 angula below this one, the nipple 2 angulas below. But did we learned that? Did we ever calculate that from this, how much the Amsa is? Whether they fall in the straight line over here, which are the marmas falling on the straight line over here? Prashtavamsha, Ubadeha, the paraspinal, this one, which all falling, where it is, what is the latitude, longitude? That you have. That is why I told that not the dimension alone. Dimension also we will study. Edani marmani, triangulani, edani marmani. All these things we'll see. We are sitting actually on a gold mine. We don't know that it is gold. So when you have to do the prayoga, you will have to understand all those things. Locate properly Kachadrak and Vidapa marmas. It's an exercise for you. Now Kaya Chikitsa teachers will be there. What is the what do you call this one of definition of Apabahuga? Apabahuga. Amsamoolasthito Vayuhu. Amsamoolasthito. So have you ever asked your Kaya Chikitsa teacher, sir, please tell me which is the Amsamoola? அதுதான்ப்பா இது அம்சம் அதுக்குள்ள மூலம் இருக்குது Amsamoolasthito Vayuhu. But where the Amsa starts, that's what I told you. You should have some insight over there. Where this is the appendicular skeleton, this is the upper limb, left upper limb. Where does it originate? That origin point is the moola, is it not? It is not originating at the axilla. It is originating at the above the Amsamarma. So that is why the Nasya and all are Prayoga there. Otherwise it is only Amsasandhikata Vata. Apabahuga is Apabahuga, Amsamoolasthito Vayu. So the knowledge of marma, what I am telling is the knowledge of marma will make you understand the vyadis and their prakatana better, because Ayurveda Shastra has not told marma separately. A BAMS student should be able to analyze the body with the marmas. Okay, next. Clinical presentation of marma injury is a good guideline to consider the diagnosis, prognosis and treatment outcome. We thought that some marma point, this thing only, that is marma chikitsa. Now I am telling you that it's a good guideline to consider the diagnosis, prognosis and treatment outcome. Is it not? The case with this one, pain in the joint of the first metacarpophalangeal joint, it comes, or the radial metacarpal joint comes, you have to examine. You have to see whether it is where the structure is damaged. We are doing that. So, and that will determine whether it is solvable, it is susadhya, it is prachrasadhya. Anyway, every marma, this one is prachrasadhya. So, in that, how much susadhyatam you can make it. What are the signs of amsafalaga injury? You studied it. That's what happens. Like, which has to be the marma. Though because the classification is like that, it is in the second year, first year subject. After that, you don't apply it at all. Then final year chikitsa also you don't do it. Here I tell that you ask my people when in the clinic, if somebody is coming with, hey sir, this one is getting weaker, it is becoming smaller. I am not able to lift that much weight. I am not was able to lift it. Immediately we tell that examine amsafalaga. Modern, you will be very, very, very happy to tell. I know that. Sir, brachial plexus neuropathy, brachial neuralgia. But when I tell that it is amsafalaga, this one, irukkalam sir, maybe sir. My professor went and told, he went to Bangalore for an exam, Mohanlal sir. Went for an examination in Bangalore itself. Chalya. Then that girl, he asked, what has Sushruta told about this? Some topic he asked, it seems. Immediately the girl told, Sushruta might have told something. Okay, do you know that? No. Then come next time, he told, it seems. And he asked him, she was very upset, it seems. Are you a modern student or an Ayurvedic student? Then you are bound to know it. You get lost. I am telling that example because every time you put the question to yourself, and then no teacher will put. You will make it better. So until now, if you have not recollected amsafalaga injury, what are the consequences? Bahu shosha, bahu swapa. When a patient comes with bahu swapa and bahu shosha, you can say that 3 months back, 4 months back, 6 months back, or a disease at that place. Okay. Again, I have asked them to tell like this. Aditya, you can go on. Next. Next, whether Krika, did we talk? Whether Krikadiga marma injury can be handled easily. Can it be handled easily? We're talking about a cervical spine injury. It cannot be. So much of risk is there even when transferring the patient. So you have to be very much sajja. Next. Knowing the samprati is in pathology, knowing the samprati is very much needed for designing proper therapeutic interventions. Agreed? I think all of you agree? Yeah. Is shock syndrome described in Marma Shastra? Shock, when I ask, all physiology who have learned physiology immediately are going to tell, sir, there is hypovolemic shock, there is neuropathic shock. Is it not? Have you studied those things? Hypovolemic shock, psychogenic shock, neuropathic shock, pain shock. Is it mentioned in Marma Shastra? Because that is what is mentioned in Marma Shastra. Whenever there is Adichoba of the Vayu, there is a Marmachoba, immediately it is not just the pain causes sometimes unconsciousness and death also. There is Siramarma injury is there, so much of blood flows up, immediately there is a hypovolemic shock. This is what Sushruta you learn, Ashtangradaya you learn, whatever, everyone is telling about that only. But that is shock syndrome, what we study in the modern medicine, somebody has not told you. So you don't think about it also. Next. A Vaidya is complete when he knows what he should not do. The knowledge of the effect of marma injury makes him recognized. Do you want to get recognized? Learn marma. Because there you learn where you have to do, not just where you have to do. How to get into the Padma Vyuha, that you can know. How to come out of it, you have to know. So that is the thing. That makes you complete. Okay, what are the complications of Urmi Marmachada? Here only one thing I tell you that, that whenever a Marma Abhigada has been told, there will be the consequence have been told there. It is not, for example, Jana Marma, Ganjatvam will be told. Is it Ganjatvam only if the Marmachada is happening? No, you have the Samanya Marmachada has to be listed. You know that it is a Sandhi Marma, so Sandhi Marma with the Lakshanas will be there. In that Sandhi itself, this Sandhi is a conglomeration of this Snayu, Siddha, Taruna Asti, the Sleshmadhara Kala, the Sleshma in it. So where it has been injured, that you should know. Accordingly, the treatment will differ. So all those symptoms you will have to apply over there. The later consequences is only listed as one thing. So understand that right from Samanya Varmakshata Lakshanas you will have to take. So that to tell that only I was telling that. Importance of giving proper treatment. Limping is caused by the injury of dash marmas. Jana marma Vigada causes, is it not? Ganjatvam. Yeah. And only Jana marma? Any marmas in that lower shaga which is affected will cause that. So, no, sir. Acharya has told that Ganjada only in Janu. You should not be that much fool that to tell that Acharya. Acharya, when you tell the other shaga marmas, all are interconnected. That is why after the Nasya, when you do the Talaharat massage, it is giving Poshana for all the other marmas. This is what you have to know. Punitva deformity is equal of which marma injury? Punitvam is what? Crookedness. Supracondylar fracture with brachial artery injury, Falkman's ischemic contracture. Punitva. Purpara marma. So, when you learn modern, you can very well understand that, oh, this is what Acharya has already told. But when I ask that, when you do it separately, study it separately, you tell that Acharya has told about Punitva and all. The credit actually has to come to, is it should be called Falkman's ischemic contracture or Sushruta's ischemic contracture. Understand that? Okay. The list of marmas in the head and neck contains all functions of special organs and nervous system. Hidden facts. Okay. Are cranial nerves or something similar mentioned in Marma Shastra? Are cranial nerves mentioned? How many pairs are there? 12 pairs. Which are they? See. How wonderful, no? We all know that. Now, Marma Shastra, I am asking you, please tell me which are the marmas doing the olfactory function? Which one is doing the hearing function? Which is doing the vision function? Are they all two? Are they all pair? Which one is doing the taste? Which one makes you speak? Neela, Manya. Is it not there in our Marma Shastra? Oh, that we know. Olfactory, optic, oculomotor. Mind you, you are respected for the Shastra which you are learning, not for anything else. So, put your head into it. Whatever you have studied, revisit it, revise it. What is the inner meaning of it, you find out. Marma skill of the physician, the skill of the treating physician is much emphasized in Shastra Granthas. Experience is needed. This one is of a opening of a log, which usually we have in the farm. Tiravugol, we call it. Does mishandling a Rujagara Marma injury result in Vaikalya? Sports medicine, it is very important that the sportsman comes with an ankle injury, which is a Korsha Marma Vigada, Rujagara Marma. You are dealing with wrongly, you are asking that, okay, it's okay, you run without giving proper rest, he will spoil this one. He will become Vaikalya. Okay, remember that. So the skill of the physician is very much needed over there. Next, Bhagnas and Marmas. Fracture and dislocation management by Asti Marma Vaidya requires thorough knowledge of the Marmas. Is it needed? Any fracture which occurs in the Marmasthanas will be very difficult and it will have complications. If it is in the Amarmasthana, it will not. Remember that. Are Sandhi Bhagnas or Asandhi Bhagnas more disabling? Why? Almost all these Sandhis are Marmasthanas. They are difficult. A dislocation has a chance of recurrent dislocation than a fracture of recurrent fracture. Understood? Shoulder joint dislocation is there, you can get into a, but not when you break a bone here. Every time whether it breaks there. No, if you have that impact only. Okay, next. Marma, uncover the facts. Complications of Marma injuries in thoracic region are well described. Are they? Have Acharyas told about pneumothorax? Have Acharyas told about hemothorax? Have our Acharyas told about pyothorax? Have our Acharyas told about pneumonia, fever causing Shwasa and Kasa after Marma injury? All the 8 Marmas there are Kalandara Pranahara. They all lead to bleeding into the cavity, Rektam Puyam Vyadi. That Rekta becomes septic and then Puya it forms. All these are told there. Are we listening? Are we reading it properly? All chest injuries are told, and so critical care has been told over there. We have to understand that. What does it has? You know that. So which are the marmas? Stanarohita, Stanamola, Apalapa, and Abastamba. Next. Emergency care, life-saving resuscitative measures are told in Marma Vijnana called Ilakumurai, Adangal and Marudattu. Marudattu in Kalari Chikitsa. Whenever there is it is all relocating the Vada. Vada has been stabdha over somewhere, you release it. It is over somewhere there, Adangal. Adangal has 2 meanings. This is Adik, wherever the reservoirs are called Adangals. One river is flowing, a lake is forming, that is an Adangal. Another, in functionally, when you say that, when somebody is, Shreyas is fighting with somebody, then Adanga Manisha. So Vadam, when it is Prakopita, that Adangal is done. Whenever there is somebody, say that they are in very much pain, you have seen it, no? You are just putting a hand over here. Pain will become less. Okay. Be comfortable. Slowly what happens? Every child is being, when a child is crying, so in massage we ask in Marma massage, whether you have to rub fast or whether you have to rub slowly. Whenever Vada is Prakupita, rub slowly. A child which is crying, if the mother is beating, Arayar, and what do you call? Arayar, it's called this one. If you do Arayal, then it will shout louder. But when you have a caressing massage, it goes for. So this is what. Okay. Whether intensive or critical care thought about in Ayurveda. These are all rib fractures or conditions like that. Next. Critical care has been told in Ayurveda. They did not have that much of facilities of ICU and all. Now adapt for ICUs. There is nothing wrong in that if you can save the patient. And a Vaidya cannot talk about, without doing his job, he cannot talk about Vidhi. Because he has been made to understand himself that Bali Purusha Karohi Devam Pyati Vartade. Until the prana is there in the kanta, he has to treat. So if you are having a chance of getting it corrected with a mechanical aid, artificial breathing, this one, you can try that. You can go for that. It is all advancement of the mechanical advancement of the same theory. Marma need to know other schools. Yeah, knowledge of contemporary sciences is needed and helpful in understanding our own subjects and enrich it. How many Marmas are there in Kulabhyasa or Kalari Marma? How many Marmas are there in Kulabhyasa Marma or Kalari Marma? There are 64 pairs of Marma. There are different schools. Kalari schools, Parashurama school does not have too much of written documents. You have the Marma Darpana book which has been, and everything which you see, you can see that somebody from Europe comes and takes it out, write it, and then we go gaga about it. We ourselves won't do it. So now Ayurvedic students are following textbooks written by Frawley and Svoboda and all that. Whereas you don't have time, or we don't have time, teachers don't have time to talk among themselves. This has to be broken out. How many Varmas are there in Kulabhyasa Varmas? 64 pairs generally. What are the main two classifications of Tamil Varmas? How many in each? Puglandi is there, I am afraid to tell, but it is 108, 96 Padu Varmas and 12 Padu Varmas. 12 Padu Varmas fall in the Nadis and they are connected to the 8 Varmas each. 12 into 8, 96. Okay. Marma Vijnana has relevance. Did you realize Marma Vijnana has relevance in all Chikitsa Kramas in Ayurveda? A Kaya Chikitsa Panchakarma doctor is doing for exfoliative dermatitis a Takra Dhara. He is getting good results for that. How do you explain with all the dosha Vijnana? Or what makes the changes in the doshas? Where you are addressing the problem? You are addressing the problem at the Murda itself so that you get the effect of overall. You see the involvement of Pranavada over there, you see the involvement of Manas over there, then you focus there. So only through Marma Vijnana you will be able to connect all these missing dots. Why it happens, what it happens, how it happens, etc. So remember that. How many Marmas are touched knowingly or unknowingly during Nasya Karma? Now everyone knows the Nasya Karma. Have you ever thought that you are handling Marmas when you are doing Nasya Karma? If not, if you have, good. If not, think about it. Again and again I ask you, apply your Marmascope. View it through your Marmascope. How many Marmas are? Intelligently you can tell that 37 Marmas are there in the Urdu Chitragada, sir. All those things are involved. Okay, good. But then, how can you reason for daily Nitya Vrta, in Dina Charya, it has been told that daily if you do Nasya, you have Aksha Padava. Okay, 96 it is there, you get Aksha Padava. Well, 37 are there, Aksha Padava. How you get a good Skanda and good Vachas and good this thing? Are you involving any other Marmas during the procedure? Just think about it, think about it. Is there a pattern which you can develop while doing Nasya Karma Abhyanga? You are putting oil on the Adhipati, then if you can make a pattern, you can start with the Stabani, go to Avarta, come to Abhanga, go to Shanka, go to Utsheba, come back to Stabani. Then you can have the second way, where from there you start, Stabani you start, you come down to the Vidura, you come down to the Fana, in Fana from there you go to the Neela, Manya, Madriga. Back you go, you do the Panchaseemantas, or after the Adhipati itself you do the Panchaseemantas, then you go back, you go to the Prikadiga, from there your hand goes to the Amsa. You can go up to the Amsa Balaga if you want, like the shoulders. And in this one you come up to Lohidaksha itself. Are you doing it? Are we doing it? Massage before this one. We are doing it. Now from this moment onwards, think that with which all movements, which all marmas are connected and how they are interconnected, whether in your standing, in your balancing, in your coordinating of the movements, whether your eyes, nose, ear and the touch sensation are having equal this one. Think about it. So that is how it is effective. You can see that after the procedure, you are rubbing all the Talahrit into 44. So almost when you do an Nasya Karma properly, you are almost handling all the manas except but when you do that, when you do Adhipati, then you know that you are doing for the Hridaya and the Vasti also. Now Nasya I told. Now think of Nadi Marma Abhyanga, whole body, 1.5 hours by one Marmani on a patient. Think of that. Can you realize that? That's it. So that is the relevance. No, it's just what is there in the book. Doshaja Marmagada, Marmakshoba Nidana, different unwholesome food habits, suppression of urges. Remember, my dear children, that Marma starts with the 4th chapter, Ashtanga Hridaya, Roganulpadaniya. Most of the diseases now are due to that. Our lifestyle, Ayurvedic lifestyle management is not management, diseases management is not management of obesity, diabetes, and hypertension and cancer. It is teaching the people how to handle their Vegas properly and establishing the rhythm in that. If you are able to maintain the rhythm in the Vegas in your body, not interfere with that, not provoke it, then you are half done. Marma also tells that one. Day sleep, keeping awake at night, you know that Vata, Vriddhi Karanas all have been. Sarvaroga Nidana you can see. Vata Vyadhi Nidana you can see. Vata Vyadhi Nidana we are misreading because now we are very secular. No? We don't read the first sloka. Vayuhu, Vibhuhu, Vishnuhu, Samharta. This we don't explain. Because we consider that was something related to Vishnu, Narayana. So it should not be talked in this one. That is the universal representation, Vishnu, in the body, Vayu is the representing the whole thing. So that is why in Vadagalagalyam it starts with Vayu, Tantra, Yantradaraha. Okay. Time is a factor. Next, please. Okay, Vegas and Marmachoga, that's what I told. Now, Adho Vada, Vega, Toda, and all these things it will affect. This is the manual, you know that? Marmascope I gave you. You are having it. You are owning it. Now the manual is there, no? How to use any scope, any instrument, you have to have the manual. This is the manual. Think of the Vegas, which all the Marmas are responsible for that Vega. If the Vega is provoked or suppressed, which all Marmas will get affected. Yadis occurs like that only. Okay, Shavadu, Trishna, Chut, Kasam, Nidra. Next. Sramashwasa, Zramba, Asru, Chardi, Sukram. Now I give you time where you can sit back when you go home. Sit with the Gunma Nidana chapter or Arsho Nidana chapter, whichever chapter you like, you take it. Write down the symptoms and this symptom, whether it is there in Vegaroda, this symptom which is there in any of the Marma, this one, you try. You will get it. Urustamba, Gudabramsha, Gudharti, Nanatmada Vyadis. These are Nanatmada Vyadis. Next. Shroni Veda, Rudrava. Now this is very important. Ardida. Ardida. Ardida is a very complex situation, is it not? It involves many of these special sensory function laws. So which are the marmas which are responsible for that? When you do a Shira Duma, Abhyanga before that, whether you can stimulate on these marmas which has been affected. Prana Hani is there in that marma. So that marma is not able to do that function. How you can restore the prana in that? Modern we tell that now we are doing Abhyanga sir, because of that we are giving tactile sensation. Then the infarcted area is there, around there are some cells which are not fully dead, that we are stimulating. I am just telling that, okay, you are correcting the prana. Okay. Okay, there is, don't worry, these slides can be there for you. Mogatva, Anila, Manya, etc. Now, treatment of Marma injury. Marma injuries are difficult to cure completely even if all efforts are taken, unlike injuries to the other parts of the body. They require utmost skill and good knowledge of the Shashti Rupakramas. Okay. Sir, Shashti Rupakrama is told by Acharya Sushrita for a, what do you call, Shalya Karma only, no? Shalya Karma is one among the Shashti Rupakramas, that's all. Panchakarma is also there. Thank you. So all the Shashti Rupakramas you should be knowing. Next. See, the other one may be interesting for you. Teaching is complete when the teacher is subject for that. So, no, before that. This is a teaching class actually, hands-on training. But how do you massage? I tell that, okay, you do massage in this. It is very easy. Ask Polindi, ni ara matra vachu pannapa, ni mukha matra vachu pannapa, ka matra vachu pannapa. Enna ka matra mukha. If you don't feel that. It is like you hurt somebody this much only. You hurt somebody this much only. This much is what? That is what I tell you. Give an example that take oil. Nobody. I don't come in for the class like this because I have a travel after this. I am. Otherwise, I come in a slack only because you should be ready to have oil in your hand and do it. There are experience. My students are there who have experience. So you have to see you have to make them do, see how much, measure it for them. No, still more, still less. You'll have to. Santwana, Snehana, Jevaniya, Brahmana, Sambana, Ropana, Vadavittagna, Balya Rasayana. These are the principles of Marma Chikitsa. Marma Parivalana, Marma Chikitsa, these are the things. Methods are Abhyanga, Pichu, Lepana, Bandhana, Veshtana, Trasana, Sega, Dara, Shirovasti, Nasya, Karnapurna in Urdu Jatragada. Every different types of Pindasvedas which you can decide. Pindasvedas can be of many types, depending on the dosha dushti, depending on the function karma which you want to restore. If there is stambhana, you have to make chalana. If there is chalana, you have to make stambhana. Whenever vata is, if chalatvam is increasing the pain, you have to do bandhana veshtana. Any type of veshtana, new veshtanas, everything you can use. Only when chalatvam increases the bhuja. But shoulder is not lifting, then with overus you cannot give. You have to mobilize it. Chalatvam has to be given. So even Murda Taila, when you see, there is the dhara, there is the vasti, piju. One is chala swabhava, another is stira swabhava. So after correcting, then every Patshagata Rogi you do the stiratvam. Is it not? Last only you do vasti. Nowadays we don't follow all these things. Even if a lumbago pain comes, there is a fibrotic, inflammatory fibrosis, then only thing what you have to do is a lepa. Sometimes our Panchakarma specialist will make a kati vasti over there. Very bad things are happening. It's not very bad things in the sense unwanted things are happening, not bad. See, if you can solve a problem with a 10 rupees, whether you will go for spending 1000 rupees? No. That sense also should be there. Next, internal medicines given by oral or other routes, external treatment given locally on the site of Marma injury. Psychological and rehabilitative treatments are also advised. The Marma physician, I told that he has to address not just the Adivaudiga Dukkha, Adhyatmika, what do you call, Adidevika Dukkhas have to be addressed by the physician. Then only he becomes a complete Marma physician. Okay, next. Adangal Prayoga in Tamil Varma Shastra, method of controlled manipulation of the point to counter an injury to another Marma point. Somebody started with a pain in the knee joint, has started limping. Then there is suggestion that controlled manipulation of that joint, that Marma, will prevent that going for limping. You are restoring the prana there, you are restoring the enlivening the tissues there. Now if I tell that you are pranifying, then you will not get it. But if I use the word enlivening the tissues, regenerating the tissues, re-strengthening the tissues, rehabilitating the tissues, rejuvenating the tissues. Because I tell that, Hemalata madam will be agreeing. We are all the people who learnt from Shastra through local language Vyakhyan. Now you are all learning oleation, sudation. You are not talking about Bhagya Sneha, sir, oleation, sir, sudation, sir. So please try to get into your own language. This may be also called Marudat. So in Tamil Varma Shastra, method of controlled manipulation to count of the point to counter an injury to another Marma point. இதெல்லாம் இங்கே ஆள் இருக்காங்க, நிறைய மர்ம சாஸ்திரம் இங்கே தமிழ் வர்ம சாஸ்திரம் எல்லாம் படித்தவங்க இருக்காங்க. You can utilize them. Today after evening you don't have a cultural program, means let it be. You make a Kulendhi sir, why not? Next, Aushadha Yogas, Marma Gudiga, Lagu and Bruhat, Nagaradilepa, Marma Kashaya, Nadi Kashaya, Muruvanna, Ashavanna, all Kashayas and Taila Yogas. My dear students, we were allowed to use Ganja and Karpu, opium and this one. And almost all these analgesics had that. This Lagu Marma Gulika has it, you will get it on scheduled medicine, you can get it on prescription only. But government rules have become that always the Ayurveda Vaidya is the culprit. Whether you sell Arishtam or whether you make you have Kompanjadi Gulika without Kombu, you have Gorojana Gulika without Gorojana, you have Kasturiya Gulika without Kasturi, you have Dashmula Arishta without Dashmula. Only Dasha Kanda are there. Now it's high time our people tell that Dasha Kanda Arishta. Because lesser than Mula, it will be there available in the Kanda. Okay, next. No, the other, just I am telling that because not to tell wrong things only. It is you generation who have to address it. That is why. Now this part we are going off. Regarding each marmas, you have it all in your textbooks. There is nothing new in that. Epilogue. So regarding uses of marma for treatment, no direct reference is available in Ayurvedic texts. I must commit that. Marma Chikitsa, Acharya has already told that the marma paripalanam has to be done. Marma Chikitsa is knowing the marmas, doing the marma kshada chikitsa. Marmas were never asked to be provoked. So then, okay, that's why I told that Arthavati, Tandravati, you can, if you are going to get Ganjada, you can controllably use it. But why it has not been suggested by the Acharyas is that you will provoke a Vataroga. So if you are solid in that, if you are knowing that, you can do it. Otherwise, don't meddle, causing another Vyadi. You have to do Shuddha Chikitsa. You cannot do Ashuddha Chikitsa. So that is why I always again tell that who becomes a Daksha? Daksha Tirtha Artha Shastrato Dushta Karma Shujur Vishak. If a Shuchi Manas, Shuchi Sharira, if you see your teacher, Guru or the Karma Abhyasi who is doing that, this one, Drashta Karma, that will make you Tirtha Artha Shastrartha. Even the text is cryptic only, you have to read from this side, Arabic like. If you have to be Shuchi, you have to be Drashta Karma, then you will become Tirtha Artha Shastrartha. That person, when he is in the society, he will be recognized as Daksha. He will be the leader. Okay. It is used in local coloring, Bhagna Chikitsa, manipulation treatment, and acupressure, reflexology, shiats. Abhyanga, Udvartana, etc. can be made more effective with the knowledge of Marma. Nasya, I gave an example. Okay, now there is another, the second part of it, like Abhyanga techniques and their use in clinical practice. In the epilogue, I just don't tell that Abhyanga can be made good with the application of Marma, Vijnana, etc. I will just show the massage part of it. I am not going to tell. I think I will share the slides. You can run one by one the slide. No, continue. Next slide on. Yeah. The objectives, outcome in a class, what should you have? I told you you should have some objectives when you come to the Marma Abhyanga class. The objectives, outcome, learner should be able to understand the following preparatory. The learner should be able to perform a massage as a massage therapist to alleviate the pain and suffering of the patients approaching him or her as the first line of treatment. See that you don't have, I started my practice with just my consultation table and my examination table. In that examination table, I used to massage all the knee patients, all the ankle patients, all the shoulder patients. I was used doing Nasya, etc. No Panchakarma theatre over. Later only the IP and all came. So in the minimal area, in your own house, in your own place, with the most important yantra which you are having, which is that Hastameva Pradhanadamam. You don't do Abhyanga on the paper. You put Abhyanga for 7 days with this Taila. Who is doing it will be doing according to his buddhi. Paricharaka, if you are trained as your extension of your hand, good. Otherwise, don't. You do it. That's what I'm telling. Small thing you do for one pensioner who is having knee pain, he will bring other 3 pensioners. next day. I guarantee you, Modi's guarantee. You do, somebody is coming with pain, then you will realize, oh, my hand is having this much of power. You will, for that, one thing you have to do, get up in the morning, karagre. Then you realize that, okay, my hand is having that power. This is the Dakshina Bhaga, this is the Vama Bhaga. People doing a ankle band or ankle protector bandage, you are using it. Okay. Is there any pain now?
So while climbing stairs, or else if I try to sit down, I'm having pains.
Where it is paining? Where it is paining?
Yes.
On the lateral part only.
Yes.
Do the pain comes when you try to repeat it like this?
Yes.
So it is an inversion injury. Even if they don't tell, you can see that while falling how you feel, because the biggest difficulty for the patient is that how did you fall? If you ask the question how did you fall, imagine that foolishness. If you are knowing that you are falling, you will not fall. Your manas is somewhere else, your body is somewhere else, you fall. That happens in a situation where nowadays, even while walking through the steps, people are seeing WhatsApp and then walking. Sometimes it can happen. Otherwise also it can. Floor is slippery, it can happen. So it's an inversion injury. She has already had 1 week of bandage already, and then okay. Now we can give a rehabilitative bandage only, because she is already recovered. One point where it is paining, there alone it tends to be. Any difficulty in movement now?
No, sir.
Stand on that leg alone. Come here. Stand up on that leg alone. Are you able to bear the weight? That is the thing. Whether you are going for a therapeutic this one or a rehabilitative. You know that it is injured, but dharana shakti has come back. The asti dhatu, the dhatus related to the asti sandhi there, which are the snayus and this one, they have regained back the strength. There is no pain. If she is developing pain, then immediately you see that it is still there. You have escaped out of that. Now you are wearing a protective this one, no? Now just you will give it. Ready? It's better to, the Vayu Chova will not occur if the patient is lying down. You can lie down if you want to see. You lie down. Okay. And then relax. Now you can see that you have to see the patient so that the patient is keeping the the leg relaxed. So one thing is that when she lies down, more of relaxation will be there. Otherwise, so you have to see that you have to acclimatize this one. Keep it this one. I'm not going to do anything. Where do you get pain? No. Now when I see for the tenderness, there is no. I am seeing at the Kurcha Shiro Marma. I am seeing at the Kurcha Marma. I am seeing at the Gulfa Marma. Gulfa Marma, you have to see that. Just. You are Malayali or Tamil? Tamil. Melagiri pannu. Inge. இந்த கால் பண்ணு. சும்மா ஃப்ரீயா. அது மாதிரி இது பண்ணு. மேல் பண்ணு. So this is what you see, whether how much movement is there, etc. She is able to. இந்த பக்கம் பண்ணும்போது இங்கே வலி ஆகுதா? So when she is இங்கே இருக்கா? இங்கே. தொட்டு காமி. So there is a lateral ligament. Now see her face. This thing. So this is healing already. Now இங்கே மட்டும் ஒரு இது வச்சு oil is there. Okay. Loose out. So why we do this is that too, once an injury is there, the muscles she will be always having a protective walk. So she will be using this arch more than this one. She will be walking like that. So I got a pop in this one. So that has to be straightened. Okay. You see that this thing in the arch, you are correcting it like this. Okay. Here only this thing is there. Linimenta? ഒരു രണ്ട് ഡ്രോപ്പ് മതി. Whenever you are massaging, hold this one like this and then go for a massage. Now I am not doing much of any manipulations over there. I am just smearing, but ask her whether it is comfortable only. Can you go much more? அவ்வளோதான். நல்லா ஃபுல்லாக பண்ணு. மேலே மேலே பண்ணு. நீ பண்ணு. Feel more pliability now. Now when you walk, you will see that. Okay. Sorry, bit. Bottom. Anirudh. നിങ്ങൾ റെഡിയാക്കി വെച്ചാൽ ചെറിയ ബിറ്റ് സമയം എനിക്ക് കത്രിക ഒരു ചെറിയ എത്ര മതി കേട്ടോ. இப்போ விழுந்த இப்படி வச்சு ஸ்லிப் ஆனது ஸ்டெப்ஸ் இப்படி திரும்பி ஓடனே. That is the history which you have to. She was climbing down the stairs. Suddenly somebody called. She thought, and then this one rotated, and then inversion injury. Yeah. This actually we use a Muruvana pad for healing. We keep it over there. This is just a restrictive bandage which I are giving, Piju Bandhana only, because strict immobilization phase has been over. And what I will suggest her that later she can apply some Muruvana over there. One thing is that when the injury is towards this side, you will have to keep the leg this side. So you will start the bandage from so that the leg will be reverted. This is the staller where you are stalling the bandage or fixer, and then you come. This is a figure of 8 bandage, Swastika Bandha in the. Again you stall it over here. This bandage is also a little bit broader than what is required. Now you can see that this is done. Now if you want to cover the ankle or the foot also or the heel also, then you go like this. Come over here. This she will be finding more comfortable than the halter even. Yeah, okay. Okay, scissors, cutting over, under the cutting. How much length you should be leaving should be that cutting over. And Sahai ki വാ, ഞാൻ വിടാമല്ലോ. സോ ബന്ധനമുറയിൽ കെട്ടുമുറകൾ തടവി കെട്ടുക എന്നാണ് മലയാളത്തിൽ പറയുക. തടവണത് ഒരു മുറയാണ്, കെട്ടണത് ഒരു മുറയാണ്. മൗലി സാർ നമസ്തേ. തടവി കെട്ടൽ, it is a workshop actually, 2 days workshop you will have to do, and you have to go on doing, not seeing, and then you will get a hold on it. Okay, I am very confident about Anirudh, Aditya, Garima and all, because every day they are doing 1 or 2 things. Okay, now just give a moment like that. Okay, fine. Hold it, don't get up, keep it down. Are you comfortable, or is it very tight? Not very tight, no? It will get this one. Now you try to move up, down. Really? Now you just get down. Yeah, തുണിയിൽ അഴുക്കാകുന്ന എനിക്ക് വേണ്ട, ചുമ്മാ നടാ. Do you feel a good grip in the ankle? Stable grip is there, no? മടിഞ്ഞിനും തോണ്ടരുത് അല്ലേ? So that is the thing. And Murvana can be placed on the place where the injury is there. നാളെ